Hi, I'm Dr. Devayani Barve. I'm a plastic surgeon and I practice in Mumbai. In this video, I shall be talking to all of you about some common mistakes which we encounter during the before and after surgical process. So what are some of the common things which can create a misunderstanding and lead to problems before surgery? So number one, not quitting smoking in time or not disclosing about your smoking or other habits to me before surgery. Ideally, I ask my patients to stop smoking completely about 3 weeks before surgery and 3 weeks after surgery. I also advise that this may be a good time to quit completely since it's 6 weeks that you're going to be going without smoking anyway. Remember, vaping or nicotine patches also count as smoking, so that is also not allowed. The reason is that any form of nicotine in your blood system causes blood vessels to shrink, and this affects the microcirculation. So even if your blood pressure or your heart rate remain normal, this is going to affect the microcirculation near your incisions or near the skin when a liposuction procedure is done. So this increases chances of the wound not healing well or the wound opening up or some amount of skin failing to heal. Point number two, not disclosing what medications or supplements or any other kind of treatment you're on. So if you're on blood thinners, if you're on any hypertensive, diabetes or thyroid medications, I want to know. Along with this, if you take any kind of supplements such as ginger teas, high dose of vitamin E, any kind of health supplements or any kind of steroids, then I would like to know about it. What you conceal may affect the way you heal. So I need to know what may be affecting your body before we plan the surgery. Point number three, doing crash diets and trying to lose maximum weight before surgery. Yes, there are some kind of surgeries before which I do advise patients to lose some amount of weight because that will maximize the way their result looks. However, doing crash diets and starving yourself and depriving your body of essential proteins, vitamins, minerals is going to have an effect on healing. The reason for this is depriving yourself of these essential nutrients will cause a dip in your immunity, and surgery being a stressful phase, you need your immunity to deal with it. So to avoid getting infections and to avoid delaying your recovery period, it is important to eat healthy, sleep well, and stay fit before a surgery. Point number four, booking a surgery too close to a major event. So there are certain timelines that I recommend which you should follow before planning a surgery, before any major event like a wedding or an engagement or a child's graduation or some kind of a party. If you're planning for a tummy tuck, give yourself at least 2 months before the procedure. If you're planning a rhinoplasty, give yourself at least 6 months to a year before any major procedure. If you're planning a breast surgery, again give yourself at least 2 months before a procedure. And if you're planning any form of liposuction, give yourself at least a month before you measure yourself for your outfits. I see a lot of girls coming in for surgery before their wedding, and if it is 1 month before the surgery, I cannot assure you that you will fit into the clothes which you have measured now 1 month after. They will look loose on you. So before you measure yourself for any kind of expensive outfits, please give yourself a month prior to that to have a liposuction done. And point number five is having unrealistic expectations or goals from your surgery based on Instagram or Facebook and such filters. You will not look the way you look on an Instagram filter in real life because life is real and filters are not. So give yourself enough leeway to look natural and beautiful and have enough faith in me to make you look natural and not like an Instagram filter. We sculpt real bodies as plastic surgeons and not filters. I'll be doing another video on the after surgery mistakes to avoid. So stay tuned for that. Thank you for watching. Please share this video if you think it will help someone who's planning a surgery.